This episode of Common Health is brought to you by Reg Lantern. Reg Lantern is a straightforward and easily understandable software platform built to assist community health centers in staying compliant so they can focus on serving their patients rather than paperwork. For health centers that are serious about achieving, managing, and maintaining compliance, Reg Lantern provides a comprehensive approach and is an affordable and valuable solution. Reg Lantern can help your health center. Contact them today at reglantern.com. That's REG, as in regulations, lantern.com. For special discounts, mention that you heard about Reg Lantern on the Common Health podcast.
Hello, and welcome to Common Health, a podcast brought to you by the Virginia Community Healthcare Association, where we discuss all things community health in the Commonwealth of Virginia. Common Health amplifies the voices of those who are served by our community health centers and those who serve them. I'm today's host, Adrienne Harden, registered dietitian nutritionist for Virginia's community health centers. Today's podcast is focused on vaccines. We are going to share myths and facts about vaccines, discuss vaccine hesitancy, and talk about how our communities stay healthy when they are exposed to people who are unvaccinated. I am pleased to introduce today's guest, Dr. Ayesha Nazli. Dr. Nazli is an attending family medicine physician at our member health center, New Horizons Healthcare in Roanoke, Virginia. Board certified in family medicine, Dr. Nazli has been in medicine for 30 years with more than 20 years of experience in family medicine. Dr. Nazli provides comprehensive health care, including chronic disease management and acute care. She has a special interest in women's health. She is passionate about preventative medicine and is committed to educating patients. She believes in empowering people to take charge of their health through knowledge and proactive care. Dr. Nazli, welcome to Common Health.
Thanks for having me.
Yes, we are so pleased to have you here today. So Dr. Nazli, tell us, why did you choose family practice?
I like family medicine because, you're involved with the families and you're taking care of the whole family and you're looking at their medical issues along with the social issues and, some holistic care also. So it's kind of combination of all. So that's why I like it.
Awesome. And why did you choose to practice in a community health center?
I think I did my initial training, my residency training in an FQSC in New York at Long Island, and it was a very big community health center. And I think I liked the model and like everything at one place and more, and also serving the underserved. That was also the main, I think, purpose and my passion to have everybody have the health care and they can get treated and they have access to, basic health. And so that was when I came back to Roanoke and I was looking for an FQHC to work in. And then I found New Horizons Healthcare and that's here I am for last, I don't know, more than 17 years now.
Wow. We're so glad that you chose one of our great community health centers as well.
Yeah.
So Dr. Nazli, there is a lot of discussion about the safety of vaccines. That discussion heightened during the pandemic and has escalated again with the media coverage tying vaccines to autism. Have you experienced concerns about vaccines in your practice? And if so, how do you address them?
I mean, we have, people who have questions, the parents and the patients regarding, what is the safety and efficacy of the vaccine. And I think the main thing is educating them, providing them information which they don't have, and just resolving the myths, which are associated with the vaccinations. And especially we are seeing the rise of the measles cases in the country. And we just have to educate people that these diseases are deadly and they are very contagious. And, vaccines are very safe. And, and there have been studies done on them over and over again to prove their safety and efficacy. So it's just about the education and to reassuring them, and answering the questions and concerns to see what their concerns are regarding the vaccine.
Thank you. So let's talk a little bit about children. There are parents who have chosen to skip childhood immunizations due to those concerns that vaccines have serious side effects, including autism. Do you know why that belief exists? And is there any evidence that vaccines cause autism?
No, there's no connection between the autism and the measles or mers and rubella vaccine or other vaccines. There was a study done in back in 1998, which has some flaws in it, and it was discredited. So that was only one study, which kind of went all over and got people doubtful about the vaccine. But after that, numerous studies have done, and it has not shown any connection between the vaccine, especially the MMR vaccine, and autism. There's no connection between it. The vaccine is safe, and the WHO and CDC recommend strongly to get these vaccinations and to provide it to the children and even to the adults if they need it.
Very important. Thank you for clarifying that. So we know that according to the Centers for Disease Control and Prevention, as of April 2025, there have been over 17,500 reported cases of whooping cough in the United States, compared to only 3,962 cases in all of 2024. This represents a pretty significant increase of over 340%. And in the first 14 weeks of 2025, there have been 800 cases of the measles reported with 3 deaths.
Yeah.
Are these increases attributed to families allowing their children to go unvaccinated?
We have seen that the vaccination rates have gone down because of the pandemic and not access to getting to the healthcare. That's why we can see that it has contributed to somehow for people not getting the vaccine. And a lot of people traveling out of the country and they don't have the vaccine, or people coming in the country not vaccinated, and can also contribute to it. And so that's why we are seeing more cases of measles and other infections, including whooping cough.
Wow. And what about natural immunity? Some parents may intentionally expose their children to diseases like chickenpox, even measles, to give them natural immunity. Is that effective? And are there any risks to that practice?
I mean, natural immunity develops in people who have an infection after the recovery. They have, they develop some immunity because the antibodies are formed in the body to protect them. But that is not the recommended way of getting the immunity, because the vaccine is most safest way of preventing the infection and the complications of disease. So it's recommended that vaccine is the better option of protecting against the disease rather than getting a disease by itself and getting its complications.
Thank you, Dr. Nazli. And some people have also made the argument that those who are vaccinated should be safe around those who are unvaccinated because they are immune. Is that argument accurate?
Mostly, compared to unvaccinated people, they are safer than as compared to people who are unvaccinated. But over the years, the vaccinations, or the immunization or the antibody titer might go down, and that they can expose themselves to infection if the person who is infected have a high viral load and they are highly contagious. The vaccinated person can even get some, risk of infection. So it's better to know where you are, if there's any outbreak of the infection. So be careful, and mostly, these infections are mostly spread in public places, close contact. So just be aware of your surrounding, where you are. They are at risk of getting the infection if they are near the people who are infected, but the risk is low.
Good to know. Very important to know. And how can our patients and families stay healthy now and in the future as the number of unvaccinated people increases?
I think they should, talk to the healthcare providers to make sure they're up to date on their vaccines, eat healthy diet, do regular exercise, and, get good sleep, decrease stress, and take charge of their health.
So, Dr. Nazli, we've been hearing more about measles cases lately. Could you speak more to that?
Yeah, lately we have seen increase in measles cases all over the country, and 12 outbreaks up till now, and involving a few deaths also we have seen and heard about. So just want to educate, that measles is a highly contagious viral infection, which can spread very quickly from person to person if anybody is unvaccinated, and if somebody is experiencing these symptoms of measles, the virus is very contagious. And the symptoms mostly start with the cold symptoms like sore throat, nasal congestion, nasal discharge, some conjunctivitis, and then they can have a skin rash also develop after 4 or 5 days with the symptoms. and people are very contagious during that time, you know. And so, if anybody is having any symptoms, any concerns, and they are unvaccinated, they should isolate themselves so that they don't spread the infection to other people. Contact your healthcare provider for the advice and the management and how to proceed.
Great advice. Great advice. Is there anything else that you think we should discuss today that we haven't covered yet?
I mean, I will say that, just want to say about this measles, mumps, and rubella, vaccines, and that we are having the outbreak of the measles, and it's increasing all around the country. So I will, recommend that people, know their vaccination status. If they're not vaccinated, should get vaccinated to protect themselves, and also people who cannot get the vaccine, like people who are like young infants who cannot get the vaccine before 6 months of age, and immunocompromised people in the community who cannot get the vaccine, pregnant females who cannot get the vaccine. So by getting the vaccine, they will protect themselves also, and also the community around them for spreading the infection. So that is the recommendation, and know your vaccination status to see whether you are immunized or not, or you have the antibody against these deadly viruses.
Are there any vaccines that have follow-ups to them that maybe patients aren't coming back for, that you would like for our listeners to know to follow up and get those vaccines?
Yeah, I mean, see, I mostly do adult medicine, and I recommend everybody to get the flu shot every year, And people who have multiple comorbid conditions or have some chronic diseases should look into the pneumonia vaccine, and the best is to talk to the healthcare provider to see what they are due for. A lot of people are reluctant to get shingles vaccine also, which our job as a primary care provider is to educate them, provide them data and the facts to convince them to get the vaccine and to protect them from future diseases and complications.
If you had any words to share with any other providers as well as how you've been successful with helping your patients get their vaccines and stay up to date, what would you say to them?
Then tell them about the pros, and cons, and let them know that answer the questions. If they are asking and they are concerned, we have to address them until, they feel confident in taking care of their health and taking the vaccine. And give more time to the patients to educate them, give them information, to read about the vaccine. If they're not ready that day, I just give them the information, and then they come back and they say, yeah, I want it. So mostly provide them education and just to answer the question and concerns to say why they are reluctant to get the vaccine.
Yeah, it sounds like it's helpful for those providers to explore those reasons why someone may hesitate or why they're not getting it, and continue to provide that education. Thank you.
And even if they had like any negative experience, it was very painful when I got the vaccine. So we just kind of reassure them and tell them how to treat it and what to, and just the reassurance and to kind of address their issues, why they had any negative, experience with the vaccine in the past.
Well, Dr. Nazli, if you have anything else to add, let us know. We are so grateful for you sharing so much wisdom with us.
I will advise patients to, talk to their primary care provider, have a primary care provider to guide you through your health, with your health success, I'll say.
Thank you, Dr. Nazli. I'd like to thank Dr. Nazli for joining us today. Thank you to our listeners for tuning in to Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you would like to help support Common Health, I encourage you to hit the subscribe button, share it with others on social media, leave a rating and review, or visit our website at www.vcha.org.